Hello everyone, this is Dr. Swapnil Chandratra here. Today we are going to talk about what is the current job scenario regarding dentistry in Germany, which of the branches have the more potential and which are the skills you should learn before you come here that will help you to get the job as early as possible with the temporary license also. So if you haven't subscribed to the channel, please subscribe to it because such information you will not find anywhere. So let's get started. So before starting with this video, I would like to say this information is based on all the job offers which I am seeing in the market, how the day-to-day the clinic works and what is generally the requirement of the dental practice owner from their dentist. So according to them, so here the situation is like that generally when you are with a temporary license, it is little bit difficult to find a job compared to when you are with a permanent license. When you have a permanent license, you will get a job anywhere. There are a lot of opportunity, but with the temporary license, many of the clinic owners are hesitant to give you the job because they are not ready to invest on you until and unless they have some security or you bring something into the table, or they have too much of requirement. These are the things which plays a big role. So these are the branches have the most potential. So first comes is a pediodontist. If you are a pediodontist or if you are a specialist in child treatment and you like to treat children, and if you can treat the children, then you are at the highest priority. Why it is like that? Because here in Germany the dental treatments are under the insurance, and here the scenario is like a family dentist, same like family doctor in India. It's like a family dentist. So child from at the age of 6 months they start going to the dentist for a regular checkup, because insurance will only provide you some amount of percentage when you in your future life require some prosthetic option or something like that. That insurance system and all that is little bit tricky. I will make separate video regarding that, regarding the insurance system and how it is work and basics of that. But in this video we'll focus on the job scenario. So yeah, so basically here the entire family comes to the dentist regularly every 6 months or a year time, and during that time the checkups is done. So the clinic owner have mainly focused on the adults, and they want someone to treat all the children, because if the children are being treated, then their adults will be treated, so their parents will be treated. So actual money lies on parents, so they want someone to take care of all the children. So if you are good with this periodontics, then it will be a highest priority here and you will land a job very fast. The second most potential branch is endodontist. As I said, here in the insurance system the maximum money lies in a prosthetic part, okay, but in India, see, when you come to Germany, here this prosthetic part is not you can do easily like that. For example, if you want to do a bridge in one quadrant, and when you send your plan to your insurance company, then you have to submit all the documents with your X-ray, OPG and all that, and then your plan is being passed. So during that, if that insurance company will see the OPG, and if they find that there are multiple caries in other teeth, or some teeth require RCT or something like that, if you have not completed this pre-treatment, until then they will not pass the plan. So here everything is systematic. First you have to complete your pre-treatment, then you can only go for the prosthetic part. So the clinic owners are always interested in finding the dentist who can perform this treatment very good. If you are an endodontist, then you can perform RCTs and feeling better than normal dentists. So if you have that caliber, or if you have done some endo courses or something like that, then you are very useful to the clinic owner. So you will get the job faster compared to the other dentist. The third potential branch is periodontics. Why periodontics? Same again, in a pre-treatment phase, you have to complete your periodontal treatment also before you can do any prosthetic part. And the most important thing here is that periodontal treatment is entirely covered by insurance, okay, and it is also insurance pay also very much high amount for this. And this perio treatment lasts very long. The treatment duration is very long, 1 year to 2 year time. So one patient is with you for 1 to 2 years and in multiple intervals. So because of that, they want someone to perform all this curettage and perio treatment. You can do that perio treatment even after dental hygienist. You do a specialization in prophylaxis, and then you can also perform that. But there is a shortage of these people who are specialists, these prophylaxis assistant. Not every dental hygienist or assistant do that specialization. So because of that, if you have done already a periodontics or you have performed so many perio treatments, then dentists will be very happy to hire you and share that workload, and you will have a good potential. Then comes the prosthetic dentistry. Prosthetic dentistry, yeah, the lot of money is in the prosthetic dentistry, because crown, bridges, implant and all that stuff will come into that. But the scenario is that generally when you are with your temporary license and when you start your job, these things are costed very high here, prosthetic treatment, and patients are not willing to, sometimes also hesitant to pay that much of amount to an unknown doctor or a new doctor for them. So generally that portion is done by clinic owner. Slowly, once you build your rapport or you build your name in during a 1 or 2 year time, then you can, within 6 months or a year or within 2 year time, you will have your name, and then you will slowly start doing it, because people will then start understanding you. Once you have done all the pre-treatment for the same patient, then they trust you with their treatment, and then you might start doing that. That also depends on a clinic owner, that whether he allows you to do that or not. But the prosthetic part is generally carried out by clinic owner until you clear your approbation or your permanent license. So this thing, if you are only focused on a prosthetic, then yeah, for a long term it will be very good for you. But in the beginning, clinic owner will have more preference towards those dentists who are mainly all-rounder. So if you are a general dentist with an all-round capacity, then it's also very best. With some experience, then you can also be at a good priority list. Then comes the PG branches. If you are oral surgeon or orthodontics, here you have to repeat your PG if you want to work as an oral surgeon or orthodontics. And they have specialist clinic, okay. So generally orthodontic clinic only perform ortho treatment, and oral surgeon clinic all perform only oral surgery. In most of the part, there are enough oral surgeons and orthodontics there, so there is not a huge amount of shortage with them. Yeah, in some region, if you go in rural areas, then there is a huge amount of shortage. But if you are focused on metros and high-end cities, there are enough amount of orthodontics and oral surgeons. So that position is little bit difficult to get, and with the temporary license, if you are an orthodontics and you can only perform orthodontics, then you have to apply only on the ortho clinic, so your area of target becomes smaller. Instead, the entire clinic ratio you have to just apply on those particular clinic. If you are planning to work as an oral surgeon in future again, and if you are an oral surgeon, then your area of target becomes little bit smaller. So that way it is little bit tougher to find a job with a temporary license. Yeah, with permanent license you can get everywhere everything, but with a temporary license it is little bit difficult. So my tips and my take on regarding what you should do to improve yourself, well, as I said, if you can learn all these skills. Yeah, you cannot, you don't need to do a PG first in India or any other country and then come here. That's double work. Instead, do some courses or work in that field. For example, if you are coming here and if you have so much experience of doing good amount of filling or RCTs, if you are good with that, then it's good for you that with your CV you can say, and with your work you can get a good position. And regarding pediatric also, you can learn some courses like like laughing gas therapy, or child hypnosis, or children RCT, or children feeling, and all that stuff. You learn that, and those certificate courses will show that you have some skill. Work on that, and keep on working and increase your experience and build your CV. That way it will be easier to find a job. I think that will clear a lot of doubts of people, and I hope this information is useful to you. So if you have more query that which pathway you should choose, how to come here, you want to help for the documentation and all that, you can contact me. The link is in the description box. Until then, have a nice day.